We are honored to be joined by the Honorable New Jersey State Assemblywoman Shavonda Sumter, Chair of the Community Development and Affairs Committee, and also the President and CEO of Children's Aid and Family Services. Good to see you, Assemblywoman.
Great to see you, Steve. Thank you for having me.
You got it. Listen, we're involved with Kean University in a series called Urban Matters. They have an urban institute there, the John S. Watson Institute, focusing on urban issues, as you know. The most pressing 2 or 3 urban issues in the state that we must address are?
Wealth disparities between Black residents in the state of New Jersey and Brown residents and non-minority residents. We're upwards of $300,000 in net wealth for a non-Black resident in the state of New Jersey. And it really stems from lack of home ownership, educational opportunities, food insecurities. So really, the Watson Institute has been instrumental in working with the Legislative Black Caucus, in which I'm also the chair of, in highlighting these issues in partnership with the New Jersey Institute for Social Justice and the Black Mayors Association. So we've doubled down in this space.
We're going to pick off a couple issues after this, but to be clear, our colleagues and friends at the New Jersey Institute for Social Justice, the study that they did in terms of the wealth gap, $322,500 for white families versus $17,700 for Black families, $26,000 for Latino families. That's the wealth gap we're talking about.
It's real. It is real. Real dollars and cents in 2022.
Would you say that crime is one of the top 3 issues in our urban communities, Assemblywoman?
Jobs, it still stems from jobs, Steve. So while crime has risen in the pandemic, mental health issues are also exacerbated because of the pandemic, but really jobs and earning a livable wage as we talk about the wealth gap, because it creates access to healthcare, access to education, access to opportunity, which we still continue to fight for those pieces in our urban communities, and it's critical.
Childcare, our initiative, Reimagine Childcare. You were one of the co-sponsors of the very historic and significant Thriving by 3 program, which provides $28 million grant program aimed at expanding availability, improving quality childcare, infant childcare, toddler childcare in New Jersey. Why is that initiative, Thriving by 3, so important?
So, Steve, in New Jersey, we want to take care of all of our children. 5,000 infants and toddlers were not attending any child care daycare institution in the pandemic. In fact, some children who were born during that time only know their parents because we were socially isolated for the safety of our loved ones. So coming out of this in child care facilities, we had women primarily as the workforce, most impacted by the pandemic by not being open and shut down. So infusing over $28 million in grant programs, it will impact all families and help all our infants and toddlers to learn social skills, to have a safe place to learn and grow while parents may have to go to work or take care of other family needs. So it was important that we invested money into this service line of 0 to 3 for early start for safety, health, and wellness of our children in New Jersey.
Someone talk to us about gun violence in our urban communities. It's systemic, it's longstanding, and there's no simple solution. What is one policy, one action that must be taken that can at least stem the tide, improve the situation, because it ain't going to get fixed anytime soon? I don't know if there is a fixing, but there has to be a decrease in some significant way. Please, Assemblywoman.
So as the Legislative Black Caucus, we've done a number of initiatives around gun violence in our communities. One of the ones that I love to uplift is partnership with social service entities. When there's a shooting, wrapping around the entire family. It's not just policing, but it's the trauma post a shooting that hits the family and those impacted in an entire community. We had a horrific loss of a young man who was a senior in high school earlier this year, just delivering groceries to his grandmother. And the impact in our community was a ripple effect that has a lasting effect. So making sure we have the social support services to support our families during this trauma so that they can find healthy ways to heal. And that piece is important. And also safe ways to report. If you see something, say something. It's important that we allow our community safe access with our prosecutors to report if they know of a shooter in their communities and neighborhoods.
Let's talk concealed weapons. The Supreme Court, the United States Supreme Court has ruled on a New York case. It will make it, I don't want to say easier, but it's changed the law as it relates to the ability to carry a concealed weapon. New Jersey has certain safeguards, according to some, in terms of how you get that permit to carry a concealed weapon. But what concerns do you have about that United States Supreme Court ruling on concealed weapons and making it, frankly, I'm not going to say easier, but legal in more situations than ever before, please?
Steve, I'm concerned about the access to semi-automatic weapons. So multiple magazine clips, and in New Jersey, we reduced the number of magazine clips that you can have, stamping guns so we know who owns them. Let's take the Buffalo supermarket shooting where they had an armed law enforcement retired person in the supermarket where the person was shooting and had body armor on during a mass shooting of innocent persons. So making some of those pieces illegal that ship mail order to people so that they can cause harm. This is not the military. Military grade style weapons has no place in civilian hands to potentially cause harm. And we've had upwards of over 200 mass shootings just this year alone, and we're in the 7th month of the year. It's exhausting. Uvalde, Texas, the school shooting, it gets, horrific. Post even Connecticut shooting where New Jersey really went to work on making sure that we put safeguards in place. But we have to have families engaged, right? We have to have registered owners have responsibilities for the sale of their guns, which New Jersey did. So really putting some smart vehicles in place. And also, I'm a proponent of the mental health screenings because you never know when a psychotic episode may occur. And then we're sitting here with someone who has a legal weapon to discharge in an open space for innocent victims.
Let me try this real quick. The Supreme Court also has made a historic, significant, and some say controversial decision about Roe versus Wade, changing law that's been in existence for 50 plus years. The greatest concern you have, if any, about that Supreme Court decision is?
Access to health care. New Jersey has some of the highest rates of maternal mortality in the country. So access to reproductive health care is impacted by this decision. Folks like to just uplift the fact that abortions are now I just can't believe it, that some states, middle of the country, are making it harder to get access to reproductive health.
Excuse me, it is likely that there'll be 50 plus states that after the Supreme Court decision, U.S. Supreme Court decision on Roe versus Wade, it is likely that more than half of the states will ban abortion. Again, it depends upon what period of time when a woman is pregnant.
Right, a number of weeks. So it's getting complicated for people to understand what their rights are, especially if there's a compromising pregnancy. We read recently about a 10-year-old who had to leave her home state, who was in fact raped by a 29-year-old to have a safe procedure.
In Indiana, she went from Ohio to Indiana. How would that be different in New Jersey? Because New Jersey, through the governor and the legislature, have quote unquote codified the legal right to abortion. What does that exactly mean?
So it means that you can come to New Jersey and have a safe procedure, and that we will not extradite you back to your home state. We will protect the privacy, because this is also a health privacy issue of the woman and the choices that she chooses to make. or of the female. Let me say it that way, versus of the woman, of the female. It's 30 million women and girls impacted by the Roe v. Wade decision that the court made. 30 million.
New Jersey Assemblywoman Shavonda Sumter, chair of the Community Development Affairs Committee, also the chair of the Black Caucus in the state legislature. Assemblywoman, thank you so much for joining us.
Thank you for having me.
You got to stay with us. We'll be right back.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Kane University, the Turrell Fund, supporting Reimagine Childcare, TD Bank, Robert Wood Johnson Foundation, the Healthcare Foundation of New Jersey, Choose New Jersey, MD Advantage Insurance Company, the Port Authority of New York and New Jersey, and by New Jersey Sharing Network. Promotional support provided by AM 970 The Answer, and by NorthJersey.com and Local IQ, part of the USA Today network.
Hi, I'm Dr. Sharif Elnahal. Did you know that there are nearly 4,000 New Jerseyans waiting for a life-saving transplant? And 67% of those people are people of color. Just one organ and tissue donor can save 8 lives and enhance the lives of over 75 people. Let's come together to raise awareness in our diverse communities. Donation needs diversity. You have the power to make a difference. For more information or to become an organ and tissue donor, visit www.njsharingnetwork.org.